We're spending some time with Dr. Stephen Marsh here in his office, which is so easy to get to off of I-271 Brainerd Place. Doctor, there's a lot of different material that you use now more than ever, all kinds of different variables and options.
Yeah, and we've seen so much of that change in the last, I would say, 10 years or so. I've been practicing 46 years, and actually bonding was first coming out then, and then we got to porcelain veneers, and that came out. We didn't have porcelain veneers. So a lot has changed, and what we try to do is customize the work for the patient. Each thing has its place.
Okay.
And so you have to be judicious in how you choose them for the patient. Some people want it immediate, some people want long lasting, and so that's why it's so important to get the feedback from the patients.
And you sit down with every patient one-on-one and say, okay, let's find out the need here, and then let's find out what material we're going to use to create that.
And a lot depends, and it can depend on finances, it can depend on how much time they have, and each of them has different capabilities, if you will, and so we try to choose the one that works for them, and that's why we sit down, as you suggested, and meet with each other, take photographs so they see themselves how other people see them.
So now it's time for a little show and tell. Okay,
great.
Why don't you show us patients that you've helped and what material you've used for these patients?
Okay, so in this first case, this is Peyton, and Peyton years ago had what's called decalcification. Her teeth didn't look great, and as a young woman, she actually had bonding done. And bonding works fairly well. It's a plastic, it's a composite, but over time some of it stains. It can happen actually when you get your teeth cleaned because some of it gets rubbed off.
Oh, wow.
And so sometimes you see this staining, and she also didn't like the shape and that sort of thing. So Joe, we met with her, we did a wax prototype first, and then we did 10 porcelain veneers, and she said she feels very confident, they look very bright. The difference between porcelain and bonding sometimes is like the difference between a piece of china and a plastic or cardboard plate.
That's a good way to put it.
But having said that, there are times we'll go to composite. It's quick, it's easy, it's done in one appointment,
right.
And it's less than an investment for the patient. All right, so our next patient, Haley, and this is a really interesting one. So her teeth came in with decalcification, and she actually shared with me this week that her mother was always upset because when their teeth came in when she was 6 or 7 years old, they had this decalcification, these white spots that I'm talking about. Okay. She always felt very badly about it. And,
self-conscious.
And the patient, Haley, actually said she was happier when she had her braces on because it covered the teeth. That was something she literally just shared with me this week. And then what we did with Haley is we did 10 porcelain veneers. So we took off the bonding, we gave her porcelain veneers. They really won't change in color or shape. And she said she's very proud, she's a teacher, and she said she wishes she had done it years ago, but this was the appropriate time for her.
Beautiful smile.
Thanks. And our next patient, this is Ann. Ann's in my age group. Her teeth had turned dark. She's very personable. She meets with a lot of people, very gregarious, but never really smiled because of her teeth. So we did all her upper teeth with porcelain veneers. We'll do her lowers in the future, but she now has a smile she's really proud of.
No doubt.
And Yvonne. So Yvonne, we actually just finished in the last month. She had a lot of bonding. She had crowns. She wanted a uniform smile. She was really unhappy with it. Also unhappy with the symmetry. So again, porcelain veneers and crowns gave her a smile that she said she's really proud of and is glad that she came to us to have it done.
And the consistency of her smile now is something that's just...
She actually had said she wasn't sure that we could even do something with it, but we gave her options, and and we chose the option that worked for her.
Well, and the options are waiting for you too. Please don't hesitate to give Dr. Marsh and his team a call at 440-461-1003 or log on to the website. There's plenty of other pictures on the website for you to peruse, so please check it out, clevelandsmiles.com. Doctor, thank you so much for your time and your talent.
It's my pleasure, Joe.